All right. Well, I'm going to get us started. Good morning. I'm Aimee Sisson, publisher of Moonshine Ink. Thank you for joining us today in these extraordinary times. Here on the Tahoe Talks conference calls, the Moonshine Ink team swaps our reporter hats for convener hats to address pressing community issues. Today, our country confirmed over 1 million COVID-19 cases, approximately 1/3 of the global total. The battle continues, and yet every front line looks different. To help us understand our local landscape, today we will hear from and get a chance to ask questions of the top officials coordinating the region's response to the novel coronavirus. It was a juggling act to get all of these experts to have an open time slot, and no wonder, because they are in the midst of a Herculean task of understanding and responding to a virus that is still not well understood. We thank each of you from Placer and Nevada counties and the Tahoe Forest Hospital System for joining us today and helping our community be better informed and engaged in the fight against this new virus. To open, we'd like to share this quote from the esteemed scientist Marie Curie that speaks to the mission of today's call. "Nothing in life is to be feared, it is only to be understood. Now is the time to understand more so that we may fear less." The Moonshine Ink team is on the line, and I'd like them to introduce themselves quickly.
I'm Alex Hoft, news reporter for Moonshine Ink.
Becca Lux, reporter and editor for Moonshine Ink.
I'm Molly Wilcox, office manager at Moonshine Ink.
I'm Sarah Miller, graphic design, Moonshine Ink.
Thank you, guys. Becca, Alex, and I are your co-hosts. Sarah is manning the slideshow while Molly is going to keep us on time. So let's get started. Alex is going to start by walking us through the nuts and bolts of this call.
So we have just a couple ways devised to keep this call focused and on time today. Sarah made this nifty video that you guys are all seeing to kind of show you how to mute yourselves, show your video. Again, we encourage faces if possible. And then the participants panel, which is how you can raise your hand. So this bar down at the bottom of your screen, you can click on that. The video will show it, but when it comes to asking questions, we ask that you use the raising the hand option instead of messaging or chatting your questions or kind of just blurting them out, so we can be somewhat civilized people. For the chat, again, we don't want to use the chat for the questions, raise your hand, but you are welcome to use the chat to either post resources if somebody mentions something, or to message somebody privately. We are going to keep people to 2-minute responses, our experts to 2 minutes responses for the questions. Molly is going to give you a 10-second warning by literally showing 10 seconds with her hands. So keep an eye on the screen to keep yourself honest. So on the next slide, we are letting you know in the traditional way of reporting and working with journalists, you are welcome to say something that you want to keep off the record by saying, "I would like this to stay off the record." We will cut that from this video recording. This just kind of a heads up, we are recording this conversation to post later. But that being said, while we do encourage on the record, off the record, KTKE, Tahoe Truckee Radio, is actually broadcasting this conversation live, so a lot of people can hear it. So keep that in mind, and also please, for the sake of that, include your name and title if possible when asking or answering questions to keep things going. Lastly, for my little spiel is our agenda. We are sticking to 1 hour. You can see the times there. Becca will kind of jump in next with some background foundational information. Then we'll jump to the experts to talk a little bit about themselves and what's going on. Then we will start the Q&A. Moonshine itself has a couple of questions. Again, 2-minute responses from the experts, and then we'll go to everybody raising their hands and asking questions.
So This is Becca. Hi. Just a little bit of background to put us kind of all on the same page of the timeline of how this pandemic has swept across our region. The second day of March saw the first confirmed case of COVID-19 in this region in Placer County, and by March 4th, that county had announced its first death. March marched on, and a smattering of cases were announced in Placer and Washoe counties as individual schools began to close, and first Placer, then Nevada counties announced states of emergency due to the pandemic. But it wasn't until March 16th when the first confirmed case in Nevada County, the first in Truckee, the first to potentially be treated at Tahoe Forest Health System, and begin the stretching of resources that we were reading about in other places, that the Tahoe Truckees population really woke up to the seriousness and the close to homeness of what we're facing. Nevada Governor Steve Sisolak announced the closure of all school districts through April on March 15th, and Washoe County announced its declaration of a state of emergency on March 17th, the day after Nevada County's first confirmed death. March 19th marked the day that California Governor Gavin Newsom declared the first mandatory stay-at-home order in the nation, which included the closure of all businesses deemed non-essential. Nevada followed suit on April 1st, and the Tahoe Truckee Unified School District announced that distance learning would be the name of the game for the rest of the school year on April 3rd. Distance learning was extended, that it would be until April, and then distance learning was extended through the end of the school year for the Washoe County School District just last week on April 21st. Today is the second to last day of April, and Placer County is currently reporting 145 laboratory confirmed cases of COVID-19, including 8 deaths. Nevada County is reporting 41 cases with 1 death. Washoe County's current status is 508 cases with 29 deaths, and El Dorado County is reporting 44 cases with no deaths. As we round the corner on April and look to May, cases have begun to plateau everywhere. El Dorado County is allowing stay-at-home to expire tomorrow. Nevada County this week announced a move to a, quote, gradual reopening phase, end quote. And some states like Texas and Georgia are beginning reopening plans this week. As Tahoe Truckee looks to the summer and beyond, we ask ourselves if we're out of the frying pan and whether or not a fire remains looming ahead. So now, quickly, with a 3-minute time limit, although we've been informed that some of our experts may not need it, we turn to our panel of experts for a moment to introduce themselves. And I'd like to start with Harry Weis, CEO of the Tahoe Forest Health System.
Good morning, everyone, and thank you for the opportunity to share with our community. First, we want to just say quickly a very big thank you to all those tireless individuals at the county, state, or local level that have been working tirelessly regarding this COVID-19 pandemic. Also, a very special thank you. Our entire Tahoe Forest Health Service team is in awe by just the team and love expression by many first responders who did a drive-by and a flyby yesterday. It included the Nevada Air National Guard, Cal Fire, Fire District, CHP, Truckee Police Department, and the U.S. Forest Service. So our team is really appreciative of that great kindness for all the work that is going on to really save lives. And all of these individuals, first responders, and our teams are really putting it all on the line for our community every day. A little bit of brief updates in our local area. We've tested approximately 590 patients so far with 56 positive COVID-19 lab tests from all counties, including Incline Village, Nevada, Placer, and others. This morning we have 2 rule-out inpatients. I don't believe we've had a positive lab test inpatient since about April 18 or so. And our estimate is that we might have peaked somewhere as we were accelerating pretty rapidly in March, somewhere around March 31 to April 30. Just some other brief comments. We and many health systems out there are very concerned about the long-term and short-term unintended consequences of protected shelter-in-place orders relative to mental and physical health challenges, alcohol and drug abuse, people falling out of recovery, family abuse, etc. And so it's likely that healthcare teams here locally and across the country might be treating these consequences for many years into the future. We also remain very concerned about very large public health challenges posed by food, job, and housing insecurity as well. And and in addition, as we're really sharing some important information with our community, is that we're really a safe place to come to relative to our physician offices, our ER, and our hospital based on the safety techniques that we're following for our team members and for our patients as well. So we want our community to know that it is a safe place to come to and that they shouldn't procrastinate in an undue manner for their healthcare needs. We're also on a very careful 4 to 6 week expansion of services just to make sure that we don't have lingering issues that are being delayed too long. So those are our key messages.
Thank you so much, Harry. And I'd like to turn to Dr. Aimee Sisson of Placer County now, if you're ready.
Hi, yeah, can you hear me?
Yes, I can. Thank you so much.
Great. Good morning. I'm Dr. Aimee Sisson. I'm Placer County's Health Officer and Public Health Director. And let me start with a brief update on where we're at in Placer County. I know Becca shared our numbers of 145 confirmed cases countywide. Of those, 11 are in the eastern Placer or the Tahoe area. So that represents 7.5% of Placer County's cases. So the vast majority are in southern Placer County, which is where most of the Placer County population lives. We do have a total of those 145 cases, 5 are currently hospitalized, 4 of whom are in the intensive care unit, not at Tahoe Forest, but in our Sacramento hospitals as well as Placer County hospitals. And we have had a total of 8 deaths countywide. We have had no deaths among residents in the Tahoe area. I wanted to say a little bit about stay-at-home orders. The local stay-at-home order we have in Placer County, and it does expire on May 1st, and we're currently making a decision as to which direction we will go in after May 1st, and we'll be making an announcement later today. But regardless of what action is taken at the local level, Placer County remains under the governor's stay-at-home order, which is in effect until further notice. And the governor has made it clear that any decisions to relax the stay-at-home order, at least initially, will be done on a statewide level. It will not be a local decision. But even in that context, I want to say a few things about what we're looking for at the local level to feel like we're ready to reopen. And the governor has talked about 6 indicators. I've been focusing on 4 criteria that we need to have met in Placer County to feel like it's safe to reopen without getting the very surge in cases that we are trying to prevent with the stay-at-home order. And so those are having the ability to test everybody with symptoms, having adequate personal protective equipment or PPE for all of our healthcare workers and first responders, having the ability to do rapid and robust contact tracing for all newly identified cases and their contacts, and then having a decline in the numbers of new cases each day. So I do have some good news to report on that first indicator of testing, the ability to test everybody with symptoms. We, in a partnership with OptumServe and the state of California, will be opening a new testing site in the North Lake Tahoe area next week. And that site will be in Kings Beach, and it will have the ability to test 132 people every day. So that's a significant expansion in the testing capability. And it puts us well on the way to being ready to reopen in that area. Our cases are down, so the numbers look good in terms of that criterion. Our South Placer hospitals have about a 30-day supply of PPE, which is a good start for reopening. But where we really lack capacity is in contact tracing. And if we do want to safely reopen without getting a surge in cases, it's imperative that we have more public health staff who can rapidly find the contacts of confirmed cases and separate them, get them tested, and make sure that the disease does not spread beyond those initial cases. So until we have that contact tracing ability, it's not safe to relax the stay-at-home orders in Placer County. And again, reiterating that that decision for relaxation will be made at a statewide level by the governor.
Thank you so much, Dr. Aimee Sisson. And I'd like to turn the mic, as you can all see, he's spotlighted, to Dr. Ken Cutler of Nevada County. And just to note for everyone, he does have another call at 10, so use your time wisely with Dr. Ken Cutler.
Well, let me start off with just thanks for hosting this and having a forum for us to talk about moving forward. I do want to thank Tahoe Forest Hospital, all the healthcare workers, the first responders who work with them for being on the front line. And they are taking safeguards, but we know that they are at higher risk for infections, and just gratitude there. Also, gratitude to the community. Many of my comments will parallel what you heard from Dr. Sisson. We know that the stay-at-home, some people call it the safer-at-home orders, have really made a difference when we talk about decreasing transmission, flattening that curve. What we've really done with that, by people being compliant and sacrificing a lot of their ability to move, to work, to gain income, has been that we have not overwhelmed our healthcare system, and we have seen really a slowing of transmission in the community. As Dr. Sisson said, those orders will be modified over time, and the state health officer essentially sets that floor. We can be we can be more strict at the local level, but we can't be really more lax than the state order. And I think we need to move to that roadmap of recovery in a very thoughtful, phased approach. As Dr. Sisson said, there are a few things that we all have to have in place. Number one is expanded testing. In Nevada County, as you reported, we have 41 lab confirmed cases at this point. So people who have been infected with COVID-19 that have had a lab test. The United States, California, locally, we've all seen fits and starts with testing for it. There have been really blockades, barriers to getting wide-scale testing, whether it's the supplies of swabs, viral transport media, the testing equipment itself, the reagents for that, lab personnel, the amount of protective equipment people have. It's always seemed like as one supply gets better, the other has narrowed. But those things are really coming into alignment. We're also working with the state and Office of Emergency Services, along with OptumServe, to start to have that capacity to really expand testing, and that's going to be necessary, so that we've been asking people with mild symptoms, stay home, and we still ask people to stay home, but now it's going to be talk to your healthcare provider as testing increases, and see if you can get tested and confirmed. And then along with that, we expect actually a potential increase in the number of reported lab confirmed cases as testing increases, that people's infections will get more recognized. What that does is gives us the opportunity to then isolate people, and as Dr. Sisson said, then do very aggressive, intensive contact investigations so that we can have other people quarantined, give them instructions, make sure that they can recognize symptoms and to be isolated, and potentially test as well. So we've been trying to ramp up, train staff who typically don't participate in communicable disease control, but have some public health experience, and some others to bring in to really increase that capacity. And then We also want our healthcare workers and first responders to have enough protective equipment so that if there is a surge in cases, they can handle it. We do want to avoid that, which is why we need to reopen in a thoughtful manner. And then in Nevada County, as part of the reopening, we are assembling an advisory group that's really going to work with businesses and community members because they often know how their businesses act best and to protect employees and the customers, and to get their input on what are ways you can, when the time is right and your business reopens, what are ways that we can really protect people and conduct business, whether that's limited access, keeping people apart, increased hand hygiene, storefront pickup, those types of things. So we are working with a number of folks who are starting to gather and look at those questions. So with that, I'll stop, and thanks.
Thank you so much, Dr. Cutler, and to all three of you. Now, just to jump right into questions and answers, Moonshine is going to start us off, and I'll be asking the first question. And Dr. Cutler, I do want to invite you to answer first, since I know you have to hop off in 5 or 10 minutes if you have something to add from Nevada County for this question. So first of all, we want to jump in and talk about transmission. I know all three of you touched a little bit on testing and case totals and a lot of different topics. But one of the most vexing parts about this battle is that we started out knowing so little about this virus. It feels like we still may not know so much. What have you learned over the last month, and how has your understanding of the virus changed?
So I appreciate that question, because we have to recall that nobody had heard of and hadn't been identified the SARS-CoV-2 virus that causes the coronavirus disease, COVID-19, 4 months ago. Really, it was at the end of very end of 2019 that was first recognized, and now it impacts over 200 countries, and you've gone over the numbers, and it's a global pandemic. And we are learning a lot about the virus. Unfortunately, we know that it transmits easily from person to person. If you recall, back in those early days, it was felt that it had gone from animals to people, and we weren't sure how easily it would transmit from one person to the other. The unfortunate answer is that it doesn't take that much, which is really why the physical distancing has been such a key to trying to slow its progression. Another key thing that we've learned is that some people will either have very mild symptoms or no symptoms, and that makes it much harder to control. And we also know that people may be able to transmit the virus to others a day or two before their symptoms develop. And that's one of the reasons we've asked people really stay apart, hand wash, only go out for essential needs, disinfect surfaces, but also to cover their face. Not so much for their own protection, it may offer a little bit, but it's really to protect others in case you were unintentionally transmitting because you had no symptoms and you didn't realize you had it. So that's been a very big learning thing for us, and has really impacted some of the policies and safeguards we've had to put in place. The other thing we have learned fairly quickly out of China and then other places is that most people will have relatively mild disease, but we know some people, even younger people, can have severe disease, but your risk goes up as your age goes up, and also if you have underlying medical problems. So if you have lung disease, heart disease, diabetes, kidney disease, that we know that you're at higher risk for bad outcomes, being in the hospital, and even death. And so we've really focused a lot of our efforts on trying to protect those who are most at risk. And we've seen, unfortunately, throughout California, that skilled nursing facilities are areas that the virus can cause a lot of tragic outcomes and can move really rapidly. And so we've done a lot of preventive outreach. Nevada County hired public health physician, Dr. Glenna Trochet, who's been a wonderful person for us to have to do individual outreach to all of our skilled nursing facilities and a lot of our congregate group homes and out to our jail, et cetera, where we know people are susceptible to transmission. So we've learned a lot, and we've adjusted our strategies and our policies and our practices based on what we're learning. So thank you. Oh, can I add one thing?
Absolutely, go for it.
So one change people should know about is people discontinuing when you can be isolated. So if you've been told you have COVID-19, we've asked that we check in with you, quite frequently, and we've been following the Centers for Disease Control guidance that you stay home and not and isolate until you've had 3 days of no fever without using a fever-reducing medicine, 3 days of improved symptoms, and that it's been at least 7 days since the onset of your symptoms. Centers for Disease Control announced that they're going to move that to 10 days. So we've already adjusted the way we are operating with people who are positive at home and isolating. So that's just a new change as well. Thanks.
Thank you so much. Either of the other two experts on the panel want to jump in on this one, or moving on to the next question? Either way is fine.
I think Dr. Cutler explained it really well.
Yeah, I don't have anything to add.
Excellent. Alex. I think you're muted.
She is not showing as muted, so something must be going on with her audio. I'm going to jump in and we'll see if she can figure that out. The next question from Moonshine. Do you think that we have a good representation of our region's infection rate, considering that we've only tested roughly 2% of the population? Bye, Dr. Cutler. Thank you.
Thank you so much. Sorry about that.
Sure, I can take that. Can you hear me?
Yes.
Yeah, I think it's really hard to know exactly what the infection rate is in the community because testing has been so limited, and because up until now the recommendation has been if you have mild symptoms to stay home and not get tested. So we know that there are people who have had COVID-19 who are not in our case count right now because we've told them not to get tested. That's shifting, especially with the new testing site that will be opening in Kings Beach. People with mild symptoms will now be encouraged to get tested. And in fact, we're going to even start testing some asymptomatic people who are at high risk. Excuse me, healthcare workers, for example, will now be able to do screening of them. In addition to testing everybody who has symptoms. But because we have not been able to do that, we absolutely know that we have missed cases. And I think, in theory, some of the seroprevalence studies that have been done around California testing for antibodies against the SARS-CoV-2 virus could give us an indication of just what percentage of the population has in fact been infected to date. But none of those studies have been done in a very reliable way, and they use tests that have not been demonstrated to be reliable. So their sampling methods were not great, so their results are not generalizable, and the test they used has not been approved by the FDA. So I would caution anyone from drawing conclusions about the percentage of the population that has been infected based on the studies that you may have seen coming out of Southern California and Santa Clara County. But we need to do studies like that to get a better sense of exactly what percentage of the population has in fact been infected with COVID-19 to date.
Thank you, Dr. Sisson. Harry.
Just very briefly, I agree with Dr. Sisson. I don't believe we know really what the infected population number is, even though we've done, roughly 600 in our area. It's not a representative sample for roughly our primary service area is 35 to 40,000 people. And then I think also just the fact that many physicians speak to up to a 20% false negative rate with the COVID-19 lab test. So even it could be improved, I think, in its quality over the future. But so we have 56 that we have found, but, the number, just a personal estimate could be in the 2,000 to 5,000 range, but we need to let the researchers do their work on that.
Thank you, Dr. Harry, Dr. Weis. We're going to go to the next question. Alex is going to take us there.
I'm back. Okay, so the next question has to do with what we heard a little bit about contact tracing. It's clearly a key part of the toolbox when it comes to slowly reopening things. Dr. Sisson mentioned that this is a current weak spot for the region. So what do we actually need to do to beef up our capacity? And are there creative ways being explored to do that?
Yeah, I'll take this one since Dr. Cutler had to jump off. Contact tracing, the biggest piece that's missing is bodies, people who have been trained to do this contact tracing. We currently in Placer County have 6 full-time equivalent staff doing this. The governor is trying to train 10,000 people statewide. Placer County's population is about 1/10 of the state's population. And so we estimate that Placer County needs to have 100 contact tracers. So we have 6 right now. So we have a long ways to go. Those people not only need to be identified, they need to be trained, and then they need to have tools such as electronic applications so that all the data across those 100 people can be pulled into a single place and the team can work together in a coordinated fashion. Doing this on paper, once you have a team that large, is not going to work. So the governor has taken a lot of steps at the state level. They are working on an online training academy for contact tracers that's supposed to be rolled out at the beginning of May. They're also working on a technology solution for contact tracing. So that is, I believe, anticipated in sort of mid-May. So those are 2 really important pieces that would help out with contact tracing. At the county level, we are working to identify county staff who have other jobs currently, but could be reassigned to supporting contact tracing. But the reason why contact tracing is so important is that we have to be able to quickly move once a new case is diagnosed, we have to figure out who they've been in contact with recently and pull those people out of circulation per se, so that if they have already been infected but aren't necessarily showing symptoms, that we can separate them from others so that the disease does not spread into, if you think about it as concentric circles, another circle of people that could become infected. So if we don't have enough contact tracers, then the potentially infected contacts are out and about in the community, spreading disease to others. So we have to have enough people that we can act really quickly to separate those who are potentially infected, either through isolation or quarantine.
Wonderful. Thank you. Thank you. Harry, anything to add to that?
No, I think that was explained well.
Me too.
All right, so the question of reopening is top of mind for everyone across the nation. We have states and public health officials talking about softening stay-at-home orders. Dr. Sisson mentioned that the call in California will be made at a state level. Locally, the hospital recently announced a phased reopening. So in terms of a regional softening or reopening, what is the timeline? Also, could you paint a picture of what day-to-day life will be? And also, what does summer look like?
Maybe I'll give that a try and kind of just share with you. We have a expansion of service plan that's roughly 4 to 6 weeks, and it will be evaluated every week or so as we continue to monitor all aspects of COVID-19. So it's a very gradual process. The key principles of our plan really protect our patients in terms of how they will be screened, how they would be masked, questions asked and so forth, and how we screen our own team, physicians included, every day for their health status and the PPE that they wear as well. And so this will allow us to gradually reopen in a variety of services, whether it's in diagnostic imaging, lab. We did set up during this pandemic a walk-up separate lab area in our medical office building so that we could get a lot of lab done. But for example, we're really backlogged in diagnostic imaging, which may include mammography, and we really want to work on those aspects. And so that we have a custom plan that's really been set forth in surgery and diagnostic imaging, and in each of our clinics have a custom plan as well. Another tool that we have put in place during the pandemic, and it will continue, for weeks into the future, is that we've added a telemedicine feature as well. And so I think that's going to continue to be an additional service. We added a separate CT scanning machine to really keep, these probable patients, out of the facility and so forth as well. But we do believe our plan allows for greatly expanded diagnostics and some critical surgeries and even newborn treatment regimens that might have been delayed. And it's going to take us quite some time, probably just to get caught up on backlog. And then we're going to, of course, be monitoring the personal protective equipment every day, every week as well, and continuing to monitor, how many days of that we have on hand. And of course, is there any kind of a surge hinting out there as well? So we're certainly going to be reevaluating our plan at least no less frequently than once a week.
Thank you, Mr. Weis. Dr. Sisson, would you like to address that second part of, can you paint a picture of what day-to-day life will be and what does summer look like?
Sure. And, I want to just harken back to comments that the governor made in his news conference yesterday, which the viewers and listeners may not be familiar with since it is relatively breaking news. And especially because any reopening is going to be determined on the governor's timeline. So I think it's really important to share his vision of what that looks like and what the timing is. So, he's outlined a 4-stage approach where we're currently in stage 1 with the stay-at-home order. Any initial relaxation of the stay-at-home order puts us into stage 2, which is when lower risk workplaces can reopen. So that includes things like curbside retail, like manufacturing, like offices, and then some opening of public spaces such as parks and trails that have been closed. The timeline for that is weeks, not months. And again, that will be a statewide decision where we all make that transition together. Moving from stage 2 to stage 3, we'll have some local flexibility. And in stage 3, higher risk workplaces will be allowed to open. These are things like hair and nail salons. It will include things like weddings, movie theaters, and gyms. And the timeline that the governor shared for those is months, not weeks. And then finally moving to stage 4 will not happen until effective therapeutics are available. And it won't be until that stage, which is essentially when the stay-at-home order will end completely. And that's when large gatherings like concerts, like live audience sporting events, and large conventions would be allowed to resume. And again, that is months, not weeks away. So sort of in the interim, especially as we look to making that first transition to stage 2, I think what we're going to see in our workplaces as part of the new normal is people will be wearing face coverings, both the employees as well as folks entering buildings as customers. We're also going to see temperature checks become very commonplace, if not required, to enter buildings to ensure that you don't have a fever. We're also going to have a whole lot of hand sanitizer available, as well as soap and water for frequent hand washing. We'll be cleaning and sanitizing surfaces frequently. And then I think you're going to see physical dividers, plexiglass dividers like you're already seeing in many grocery stores will become even more commonplace to create a physical barrier between people. And then things will be spread out further apart so that we can maintain the required 6-foot physical distancing to reduce the transmission of the SARS-CoV-2 virus. So that's just a bit of a vision of what the hopefully fairly near future will look like as we enter phase 2. Sorry, stage 2.
Appreciate that very descriptive visual, what it's going to be like. I think that answers a lot of questions in terms of reopening. We are moving into the audience Q&A. And a reminder that we are live broadcasting. So please give a quick introduction when you are asking your question. And we have had Mark Spohr with his hand up almost from the beginning. So we're going to start with you. I'm going to put you up front. Mark, are you still there? There he is.
Yes, hi. I'm Mark Spohr. I'm a medical doctor. I'm retired. I've had about 30 years experience working in international public health for World Health Organization, USAID, World Bank, Asian Development Bank, and so on. My question is primarily for Aimee, since I'm in Placer County. I live on the North Shore of Lake Tahoe. We have a severe impact from tourists and second homeowners traveling to this area. They seem to be routinely ignoring the stay-at-home order, and we have them. They're all over the place. They're up and down the roads. They're out on the trails. They're on the beaches, in the grocery store, gas stations, takeout lines for the restaurants that are open. And I know that the South Shore and Nevada County have adopted more stringent measures to restrict these people from coming, but this is a really severe existential threat to our health up here from imported cases. And I was wondering what Nevada County what Placer County is going to do to help protect us from these imported cases.
Hi, yeah, this is a challenging situation, and we've been trying to address this with several messages coming from the Placer County Health Department as well as others within Placer County, starting with short-term rentals as one way of discouraging tourists from coming to the Tahoe area. So we have stated, according to the governor's order as well as the Placer County Health Officer order, that short-term rentals are only allowed when they're being used to support COVID-19. So for essential workers, for example, who need to be in the Tahoe area. But otherwise not allowing tourists to stay in short-term rentals. So that is one initial action that we took. We also did send messaging to second homeowners in the Tahoe area, encouraging them to shelter in place in their primary residence because of the limited capacity of the healthcare system in Tahoe to handle a surge if there were a large number of cases that could be caused by having a larger than normal population up in the North Lake Tahoe area. So those are the two major steps that we've taken to date. We haven't felt that it was necessary to close all travel to the North Lake Tahoe area as was done in El Dorado County for South Lake Tahoe, but we do continue to evaluate on an ongoing basis and can make changes as necessary. But I think with the stay-at-home order, it has certainly slowed down travel to the region. With the numbers that Harry shared earlier, you can see that there aren't any confirmed cases in the Tahoe Forest Hospital. And so those are all promising, but we do anticipate that once shelter-in-place orders are relaxed, we will begin to see more cases. And so again, we'll continue to evaluate.
Well, clearly the short-term rentals is just a small portion of the housing up here. Most of the housing is second homeowners, and they seem to feel that they're exempt, and they're routinely ignoring the stay-at-home order. We are severely impacted up here. They're all over the place up here. So your messaging efforts are not effective. And I think something more forceful is required. Something like South Tahoe has done by letting people know that there will be a fine when they travel up here, because we're at risk.
Yeah, no, I appreciate those, and we're hearing from both sides. Certainly homeowners also feel that they have a right to be in their own homes, and they do pay taxes in the area. So we're trying to balance the needs of all sides.
Thank you, Dr. Sisson. Mr. Weis, would you like to comment on this question of visitors and second homeowners in particular with hospital capacity?
Yeah, I think Dr. Sisson, covered it well. We're appreciative that we have not, been overrun at this point. I do have a concern that, if property owners do own property in this area, they should have a right to come to those properties. And I think the key thing is that all residents, whether they're second homeowners or full-time residents, that we do those, the masking in public, the physical distancing and so forth. And I think if that's done well, we'll continue to have a great outcome here. So I think there is a balance that, people do own homes here. It would be kind of unprecedented for an individual in any area of the country not to be able to go to property that they own. But I think the risk can be mitigated significantly if people will do face coverings when in public and do the physical distancing. And I think that will really remove it. And also I think the fact that hopefully we'll see evidence over the next several weeks that hopefully the virus is still less deadly than earlier estimated.
Thank you for that reminder of personal responsibility. Police Chief Lefwich of Truckee said that that's called the I factor. What can I do? Next question, we're going to hear from Sarah Lois.
Yeah. Hi, I'm actually a nurse. I live in this area, but practice as a trauma ortho nurse at Renown in Reno. But my question, again, for Dr. Sisson, kind of plays off of what we've just been talking about and what she previously had talked about. In terms of, we definitely have had, as Mr. Swoor just mentioned, a big influx of folks. And I think a lot of us here in the North Lake Tahoe area, because we are lakeside, it's not just a question of the second homeowners, and obviously understanding they have their rights as well, as you talked about. But as this past weekend where it was beautiful weather showed, it was almost like the Huntington Beach scenario where we had just a massive amount of day visitors. And so it's kind of a combination of things. And even though the message has been very clear, as you pointed out, about short-term rentals and stay-at-home orders and non-essential travel, I think all of the sudden people have fatigue with all of this. And so we're seeing a whole lot more day visitors. And then, as you say, one way we could mitigate this in preparation for any potential surge in cases is having people wear protective face masks and so forth. But I'm finding that in our area, because of all the day visitors, we don't have enough signage or messaging directly at the business level, and maybe that's coming, for people to understand, please wear a face covering if you go into these places. A lot of the locals have adapted that, it seems, but again, the day visitors that come and go either are unaware or just non-compliant because they're in Tahoe and they feel like it's a little more free. But more importantly, we've been seeing people now starting to eat at picnic tables outside the takeout places where they're not getting wiped down and all of this. We're basically seeing the what appears to be just fatigue, and people are just starting to pretty much come up to Tahoe and say, screw it, we're gonna have some freedom here. But my question stemming off that is, in terms of us stepping through the stages that you described we need to get to, in terms of contact tracing, how will that work for a tourist area like this for us to be able to track down a day visitor? The people that come literally, either maybe for an overnight, if not just for the day. We have also seen a lot of the short-term rentals are starting to flip to get away from the 30-day clause of being a short-term. So now they are starting to rent for 2 months instead of 30 days. And with May 1st coming around, I know in the area I live, I'm seeing that as some people are looking for a loophole and opening up their rentals again starting May 1st. So we've got this combination, day visitors, new rentals coming on as of May 1st. The weather is improving, and we're definitely seeing a lot of North Lake Tahoe, West Shore, all the hiking trails, everything's starting to get crowded just like a standard weekend. You know, virus be damned. So again, my question really goes to, how do we deal with contact tracing and getting through these stages that we need to do with that is pretty unique to the Tahoe area being a destination resort.
Thank you, Sarah.
Sure. This is Dr. Sisson, and I'll respond to that. Before I speak to contact tracing, I want to say a little bit about signage. At least for businesses that are in Placer County, if they are an essential business, they are required to develop, to post, and to implement a physical distancing protocol under the health officer's orders. And part of that protocol requires signage, and on that signage, it encourages employees as well as customers to wear face coverings. In Placer County, there is not currently a requirement for face coverings, it is a recommendation. But that signage should be quite visible at the entrance of all stores in Placer County that are open. So if that's not the case, you know, it is a good opportunity for us as well as for customers to educate the businesses that they do need to have that signage. Speaking more specifically to contact tracing and the challenges of doing that when there are a lot of people from outside the area who you may come into close contact with. It does make it very challenging for us to do our jobs. Contact tracing is easiest and works best when you know who your contacts are, and you can say, oh, well, I was near my Aunt Sally. It's like, okay, can you give us Aunt Sally's phone number? That's easy. When it's, I was in the grocery store and you know, we have no idea who else was in the grocery store at that same time, that's when it becomes very difficult. And I think that's why you're seeing technology companies, Google and Apple, partnering on some technology supports for contact tracing. And those would be very helpful in a setting of larger gatherings or of unknown people from outside the area who would otherwise be harder to track down. Certainly, we live in the United States of America where freedom and privacy are considered very important. Those are strongly held values. And so those apps are being proposed on an opt-in basis so that people can choose for their location information to be shared with public health. And I would encourage everybody to indeed opt in, because it will help us with contact tracing. And the better our contact tracing, the better we will be able to reduce the spread of coronavirus once we do relax the shelter in place orders.
Thank you, Dr. Sisson. Mr. Weis, would you like to comment on the question of the unique situation that we're in?
Yeah, I don't really have anything to add beyond what Dr. Sisson shared on that.
All right, thank you. Well, we are 2 minutes off our end time, and I really like to make sure that we land the plane on time. I have a quick question that I'd like to wrap up with, and that is about predicting peak case timelines. There are many models out there, and I wonder what models are you guys looking at, and do you think that Tahoe has reached its peak, is yet to get there, or are we still uncertain?
I'll start. It looks like Harry might still be unmuting. Certainly the numbers show that we have reached a peak in Placer County in terms of our total cases. You can see that if you go to placer.ca.gov/coronavirus and click on the data or cases in Placer County, you can see that curve. But when I say a peak, you know, what happens next is determined by us. It's determined by how well we adhere to the stay-at-home orders. And it's also determined by how we behave when those stay-at-home orders start to be relaxed. I know people are antsy to get out, for one thing. I know people also need to earn a living, and we're very cognizant of that. But if we do not reopen carefully, and if we do not adhere to shelter in place or stay-at-home orders while they're still in effect, we very well could have another peak, and that peak would likely be larger than the peak that we've experienced, because people have been so supportive of the stay-at-home orders. So I know it's hard. I know there are so many sacrifices that people are being made, and I want to express my gratitude for that, and I want to emphasize that it will continue to be important to adhere to sheltering in place.
This is Harry. Just very briefly, we do believe that a peak might have been reached in late March or the first few days of April. We will continue to see a lot of increased capability of testing, so it shouldn't surprise anyone that we still get, 1 to 5 or more positive COVID tests per week. I think that could continue for some time. What we are really watching is, also the level of illness too. Are there any hints that those that are being identified as positive, are they within that asymptomatic or low symptom area, or are they in the high symptom area? And we're really pleased to see that overall, if you were to graph the number of positive lab tests, it was like an 80-degree angle in the month of March, and then it somewhat plateaued with nearly a flat line through the month of April. But again, we want to see the number of hospitalizations continue to show a declining energy as well as we go forward, and we're hopeful that the late spring and summer months will do its usual thing for COVID. As I look just in my 43 years of working coast to coast in healthcare, to me, the combined COVID hospital activity in the ER and in the hospital, plus flu, if I combine both of them, this is a lighter combined influenza season than I've seen at least 2 other times in my career. So hopefully that's good news for our community as well, but let's be careful going forward.
Thank you, Mr. Weis. All right, that wraps up today's Tahoe Talks. I think Marie would be proud, because I believe we do understand more and fear less. Thank you, Mr. Weis, Dr. Sisson, and Dr. Cutler for your time today and your continued service to our community. A reminder that this call was recorded and will be released as a video, and each participant will be emailed a link. Please let us know how we did today via a survey that will be in that email. And if you have an idea or a comment for Tahoe Talks, email tahoetalks@moonshineink.com. And thank you again, everybody, for participating, and understand more, fear less. Take care.